Right, let's move on to the stories of the day now. So, Health Minister Dr. William Kize returns to the Nelson Mandela Bay Metro in the Eastern Cape today to assess the intervention at the Metro's two major hospitals, Livingston and Dora Ingenza.
Members of the Restaurant Association of South Africa will embark on a peaceful demonstration today, calling on President Cyril Ramaphosa to reopen their trade.
Two foreign nationals who were arrested at the Beitbridge border between South Africa and Zimbabwe for alleged possession of illicit cigarettes worth over 6 million rand are expected to appear in the Musina Magistrates Court in Limpopo today.
And just taking a look at those numbers again, the cumulative number of confirmed COVID-19 cases in the country now stands at 381,798. Number of deaths at 5,368. 208,144 people have since recovered from COVID-19. And a beautiful story coming through just on thatly, and of an 84-year-old who has recovered from COVID-19. So hopefully we'll be able to follow up on that later on in the show. And then the number of active cases now stands at 168,286.
Lovely, really an optimistic story there. I think we need a lot more of those. Also, just that number, I'm sure you know it by now, but let's keep reminding you, the 24-hour hotline 0800 029 999. Members of the public urged to call this number for any information. Also, that official government COVID-19 support service on WhatsApp 0600 123 456.
Right, the provincial breakdown on those numbers. In Gauteng, the number of positive cases of COVID-19, 139,435. The Western Cape has 86,329 cases. Eastern Cape, 66,759. KwaZulu-Natal, 47,685. In the Northwest, there are 14,634 positive cases of COVID-19. The Free State, 11,352. Mpumalanga has 7,664 cases, Limpopo 5,355, and in the Northern Cape 2,539 positive cases confirmed so far. And the number of tests conducted overall, 2,536,921, and some of the other statistics that we've already run through, and the recovery rate there once again 208,134, and the new cases in the last 24-hour cycle 8,170.
All right, let's have a look at that provincial increase now. This is the 24-hour look at what's been happening. So remember, we were told that KwaZulu-Natal is looking like it's going to become that sort of epicenter with the most cases reported. Well, I mean, how's that for a tie? I mean, it's not a race, but unfortunately, when we talk about these high things, you know, this is what's going on. So KwaZulu-Natal, 2,556 increased cases, same as Gauteng, 2,556 increase in the last 24 hours. So this is what's happening in the provinces. The Eastern Cape, 1,443. That's where the Health Minister is visiting today. Much concern over the Eastern Cape, the numbers and the handling of the healthcare system there. The Western Cape, 557 new reported cases. Northwest, 297. The Limpopo province, 179. Mpumalanga, 240. The Free State, 625. And the Northern Cape, 188. The deaths so far reported in the respective provinces, this is the total amount of deaths, 1,042 in Gauteng now. As you saw, we went over that 1,000 mark with the numbers released yesterday. 945 in the Eastern Cape. 2,717 in the Western Cape. In KwaZulu-Natal, 459. Northwest, 48. Limpopo, 33. Mpumalanga, 55. The Free State, 57. And the Northern Cape, 15. And then, of course, the final column is your recoveries, and they're really looking encouraging. They truly are. And, you know, Sakina, you were talking about that elderly lady, the 84-year-old lady who recovered. We have got a clip, so I think that's going to be such a lovely thing to have a look at, and we'll play that for viewers in the next hour. So you'll get to meet this fabulous lady. But I've heard a couple of those remarkable stories. I just need us to play talk about them more often. So there we go. That's that slide for you there.
And I think it's so important, Leanne, that we do speak to these positive cases, the stories of recovery, because we tend to dwell on the negative, I suppose, just a little too much. So it would be good, just to lift our collective spirits by looking at these stories. So I can't wait for that. All right, let's just take a quick look at the past 7 days. And again, we see yesterday 8,170 new cases reported on the back of 9,300 on a Monday. And as we were saying yesterday, it's now 2 days running that we are under 10,000. And, we're looking, as you say, Leanne, for any bit of good news we can find. And you rightly say this is not a race, but we are trying to find positives, upshoots to all of these stories.
We certainly are. Well, those are as you say, the past 7 days. I think we're looking at the global picture now, if I'm not mistaken. But South Africa still sitting in that top 5 of countries with the most infections. So you can see there we're at 381,798 as of yesterday's figures. So we're well ahead of Peru. Remember, we were below them and Mexico, but now we're firmly up into that the top 5 in terms of infections. We're below Russia at 783,328 cases, and the daily infections as well. I mean, this is sort of something that we must just keep an eye on, because we're still right up there when it comes to reporting a lot of infections in a day. Many other countries are not reporting as many as we are, except for the likes of the United States. I mean, the United States just yesterday alone reporting almost 56,000 cases. They're at 3.9 million. Brazil are at 2 million infections and 41,000 infections added to that tally yesterday. So that total number now, just 14.8 million, and the death toll, 614,000 deaths so far. But the recovery rate also looking positive, 8.4 million recoveries so far.
Right, let's move on to those trending topics. First up, hashtag Gwede Mantashe, and we know the minister, of course, still hospitalized. But if you look closely at this hashtag, Leanne, it actually has very little to do with Gwede Mantashe. It is Night Shift Twitter at it again, because Night Shift Twitter has adopted this thing now where they will just hashtag something and speak to totally unrelated subjects, but this thing will trend. So Gwede Mantashe is that hashtag this morning, where all sorts of things, selling masks, whatever it is you want to talk about, and you go hashtag Gwede Mantashe.
Well, that's the problem with nighttime Twitter, all those insomniacs that are causing chaos with the news in the morning. And yesterday, the funny thing is that one of the nighttime trends just carried on. I think it was Ndlozi joins DA. Now, automatically I knew, okay, no, this is nighttime Twitter playing big games with us. So that was one. But anyway, Gwede, let's not make fun of it, because he is in hospital, as well as Minister Thulas Nxesi also in hospital, both of them with COVID. So we wish them a speedy recovery. Also seeing something coming through, which was from last night, is that Andrew Mlangeni as well, not talking to coronavirus. This is, please don't say that, but he isn't well, and he is also in hospital. So we are just sending good wishes to him, as he is 95 years old. Certainly something that we need to keep in the back of our mind. I'm not going to talk about Arsenal. I mean, why?
We lost.
Okay, sorry.
After the highs of beating Liverpool and Man City, we go down to Aston Villa. But it must be said, Aston Villa is fighting for survival. They in that relegation and zone. And yesterday's victory, 1-0, actually just lifts Aston Villa out of the bottom 3 by that 1 goal, on goal difference, literally. So, Arsenal. Let's leave it there.
We'll leave it there. And then, of course, day 118 of lockdown. You've been hearing all these stories, and in fact, we're asking you, what do you think of government's reaction to the lockdown since March? I've been just in a blur. Today's been a bit sort of, I just keep thinking, how are we almost in August when this has been going on since March? It's been a big blur.